Hi, I'm Mahdiyeh, consulting nutritionist from Healing Hands Clinic. This series, we'll be talking on different digestion-related problems. Our today's topic is diarrhea. Diarrhea is the third leading cause of death among children below 5 years of age, and 15% of deaths among adults in our country results because of diarrhea. What is diarrhea? Diarrhea, also called as loose motion, refers to passing of stools 3 or more times a day. Symptoms often related to diarrhea include abdominal pain and discomfort, nausea and vomiting. These stools are often uncontrollable, loose and watery. There are several causes of diarrhea. Let me cover a few of them. The first one is medication. We often hear patients taking antibiotics suffer from diarrhea. This is because when you take antibiotics, the good bacteria, the count goes low and the count of the unwanted bacteria increases. So when there's an imbalance of the gut microbiota, that's when people suffer from diarrhea. Second is food intolerances. Often during diarrhea, we see symptoms of bloating, gaseousness after eating wheat or drinking milk. This is because of the deficiency of the enzyme lactase that is required for milk digestion. Third, there are various other infectious diseases that result in diarrhea, often related to bacterial infections, parasitic and viral infections. The fourth and the most common cause of diarrhea are different diseases of the stomach, intestine and the colon. Let's move on to the diet associated with diarrhea. We often hear patients who say they have stopped drinking water or they stopped eating food with the fear that they may continue to have loose motions. But this is very harmful. This can result in dehydration and malnutrition, worsening the symptoms of diarrhea. It is often advisable to drink liquids to replenish the loss of water. You can have coconut water, sabza water, lemon water, and sugarcane juice. It is not advisable to drink tea and coffee or fruit juices. Fruit juices have high osmolarity, worsening the symptoms of diarrhea. Second, fruits and vegetables. It is advisable to have whole fruits and vegetables rather than having fruit juices and vegetable juices. We often hear people saying if they can consume a glass of vegetable juice for breakfast or a mid-morning fruit juice. We need to understand that fruits and vegetables are a good source of resistant starch. Often this resistant starch is absent in the juices. Moreover, juices are also high in osmotically active agents, which pulls a lot of water in the intestine, resulting in more symptoms and diarrhea episodes. Consume fruits and vegetables high in resistant starch and soluble fiber. For example, bananas, pear, papaya, all the roots and tubers like potatoes, sweet potatoes, colocasia and yam. Also, as I mentioned in the beginning, that diarrhea occurs as a result of an imbalance between the good bacteria and the bad bacteria. We need to understand that if we need to decrease the symptoms and the episodes of diarrhea, we have to increase the count of good bacteria in our intestine. A very good source of probiotic and locally available is fresh curd and yogurt. You can always set curd at home. The more fresher it is, the higher the count of good bacteria. You can have curd as a mid-meal snack or with your lunch. The best thing is to soak raisins or set your curd with raisins, because raisins are a good source of prebiotics and they serve as food for the probiotics. So combination of yogurt with raisins or a combination of yogurt with banana in the evening is a good snacking option. We often hear people consuming a lot of refined oils in their diet. We need to now replace refined oils with ghee. The ghee has to be pure. Either you can make it at home or you can source it from a dairy that is reliable. Ghee is a good source of essential fatty acids like omega-3 and omega-6 fatty acids. Besides these, it is also a good source of butyric acid and fat-soluble vitamins like vitamin A, vitamin D, E and K. These fat-soluble vitamins heal the gut mucosal lining, thus decreasing the incidences and the episodes of diarrhea. So if your child or any family member suffers from diarrhea, always keep them hydrated. Do not make them starve. Give them options like sabza water, potatoes, bananas, rice, yogurt and ghee. Also, there are certain foods that you need to avoid during episodes of diarrhea. First, foods that are high in insoluble fiber. You need to avoid vegetables like green leafy vegetables and whole pulses like rajma, chana, chole. The more insoluble fiber in your diet, the more will be mechanical irritation of your mucosal lining, further worsening the symptoms of diarrhea. High insoluble fiber foods include all your beans and pulses. Do not give your patients rajma, chana, chole, watana and soya in their diet. This may further worsen the symptoms of diarrhea. Besides high insoluble fiber foods, second, you need to avoid is fatty foods and fried foods like namkeens, chivras and wafers. Do not give your child processed and packaged foods when he is suffering from diarrhea or any digestion related problems. Avoid high osmotically active substances like sugar. Do not give your family member or child any sweetened beverages like fruit juices and cola. So remember, if your child or any family member suffers from diarrhea, do not make them starve. Rather, include wise food choices like the ones mentioned before. These were some of the do's and don'ts related to diarrhea. We'll be coming up with more interesting videos related to digestion and digestion related problems. If you like this video or if you have any doubts, you may leave a comment below. Thank you.